I grew up, I was always taught to rinse and spit after brushing my teeth. However, the guidance has changed significantly over the last few years, and the recommendation now is to spit, don't rinse. And the reason behind this concept is that we want to keep the ingredients in our toothpaste, the fluoride and the other antibacterial agents, to be retained in the mouth and around the teeth for as long as possible after brushing. Hence, it's counterintuitive to rinse our mouths after toothbrushing, and instead we should simply spit the excess out and avoid rinsing or eating or drinking for at least 30 minutes to 1 hour after brushing. The longer, the better. Again, you might have developed a habit of rinsing after brushing, and that might have been ingrained since childhood. Certainly for my mum, she still tells my kids to rinse their teeth after brushing, even having me as a dentist in the family tell her that it's not recommended anymore. She insists they must. Because habits are hard to break and new habits are difficult to create. So even recently, I've also had ladies tell me that they just have to swill their mouths out with icy cold water after brushing because they can't stand to have the toothpaste in their mouth, or they dislike that their gums have bled and they want to wash that away. And I do understand that entirely, because for some of us these things can be really less than pleasant. However, I urge you to bear in mind the benefits that you get from the ingredients in the pastes over and above the need or the urge to wash them away. Having the paste there is going to be more beneficial than rinsing it away. So a word on mouth rinses as well. I encourage you to avoid using mouth rinses immediately after brushing. It's a good idea to use a mouth rinse at a completely separate time to brushing your teeth, perhaps after lunch or to freshen your breath at another point during the day. But again, the fluoride concentration of mouthwash is significantly lower than that of toothpaste, so we caution against the habit of rinsing with anything, including mouthwash, immediately after brushing. And I'm also going to encourage you to check your toothpaste and the fluoride concentration in your paste. I recommend using a toothpaste that has a fluoride concentration of at least 1,450 parts per million fluoride. That's the highest you can buy simply off the shelf. And I'm going to put a handy conversion guide below that you can refer to. Now, if you do need help to do this, because it could be quite confusing, let me know. I'm more than happy to help.